My name is Nontobeko Sithole. I work for the Catholic Institute of Education. I joined this organization in 2008 and I work as the Pastoral Care Coordinator. Of the programs that we have within the Pastoral Care Unit is the Caring Schools program. This is a program that is meant at encouraging schools to provide safety nets, particularly for orphans and vulnerable children in school communities. Most of the schools that we work with have children that come from very poor or underprivileged communities, and in this particular community we learned that most of the parents were either infected or affected by HIV and AIDS. They were unemployed, and there were other challenges in the communities that were faced by both adults and children, challenges like alcohol and drug abuse. And our intervention was actually meant to try and address all those challenges so that the community could be a caring one. During our intervention, we involve all groups of the community, namely children or learners, parents, teachers, as well as other stakeholders. And by so doing, we want to make sure that they all work hand in hand. So some of the changes that we have seen because of our intervention have come in the form of the strengthening of strengths by community members themselves, the realization of the potential that they have in changing their own lives, and the ability to listen to the children and to work together as community. As I mentioned earlier on, that most of the communities that we work with are very poor. So another change that we have seen has come in the form whereby the community is really beginning to take care of orphans and vulnerable children. For instance, in Lukau, which is a village in Limpopo, a few kilometers outside the town called Pastoral, we have seen, for instance, the establishment of a drop-in center which caters for vulnerable children, and through this center, children are offered meals and are given an opportunity to do homework and to study in the afternoon. We have also seen the development of support groups for people that are HIV positive. We have also seen the establishment of children's groups whereby children take care of their own lives and the lives of other children in the community. Our understanding is that in as much as there was a general understanding that the HIV/AIDS prevalence was high in the community, there were no specific statistics, and people were not actually open and willing to talk about their status. But because of our intervention and because of the workshops and the information that was actually shared within and amongst community members, the facilitators that we work closely with have initiated the establishment of support groups for people who are HIV positive, and of course the support group is linked to the Department of Health and the Department of Social Development. Of course, at the beginning it wasn't easy for people to actually join the group and to start talking openly about their status or their condition, especially men. But since the inception of the project, we have actually seen an increase in the number of people that belong to the support group. And I think one can actually adhere that to the fact that they feel safe and supported, and that's exactly what has made them to actually see the need to actually talk about their status, to belong somewhere so that they can actually get assistance. Just to give you a brief background about the establishment of the children's groups. When we started with the project, we involved children in our training and in our different interactives. But we soon realized that when they went back to their respective school communities, they were not given a platform to share information with other children or to actually take action. And that is how the idea of forming structured groups came about. So as an organization, we then decided to actually help those children form groups. We supported them. They were trained on the formation of groups, and teachers were also identified who could support groups, because it's very important for children's groups to be supported by adults. So that is how these groups were actually formed. And they are linked, of course, to the broader Caring Schools program, which is aimed at providing a safety net for the broader school community. So it's up to the children to decide what activities they embark on, but the general role is to actually provide a caring environment in their school community.